Are you struggling with irregular periods? Have you been told you have PCOS and are worried about your health or future pregnancy? You are not alone. Millions of women navigate these challenges, often feeling confused and overwhelmed. But what if you could better understand the signals your body is sending you? What if you could use evidence-based natural solutions, simple lifestyle changes, and the right foods to support your body back into balance? In this video, we're going to explore the fundamentals of women's hormonal health. We'll look at the common signs of issues like PCOS, discuss powerful lifestyle solutions and dietary approaches to manage your symptoms, and outline the essential steps to take when you are planning for a healthy pregnancy. This is your guide to taking an active role in your well-being. Understanding the signs. Is your body trying to tell you something? Our bodies are always communicating with us. When it comes to our menstrual and hormonal health, the signs of an imbalance are often clear, but we might not know how to interpret them. A typical menstrual cycle ranges from 21 to 35 days. While some variation is normal, consistently irregular, very painful or heavy periods are a sign that something may be out of balance. For many, this imbalance is linked to polycystic ovary syndrome, or PCOS. It's important to know that PCOS is not primarily an ovarian cyst disorder. It's a whole-body endocrine and metabolic condition. The key signs to watch, based on the internationally recognized Rotterdam criteria, often include irregular or absent periods. This is a classic sign that ovulation may not be occurring regularly. Signs of high androgen levels. This can manifest as persistent acne, oily skin, hirsutism, excess hair growth on the face, chest, or back, or conversely, thinning of hair on the scalp. Metabolic challenges. This often includes weight gain, particularly around the abdomen, and a notable difficulty in losing it due to underlying insulin resistance. If these signs sound familiar, please don't panic. This is your body asking for support, and there is so much you can do. The nutritional path to balance. Foundational dietary principles. One of the most powerful tools you have is the food you eat. For hormonal balance and managing PCOS, the primary goals are to stabilize blood sugar, improve insulin sensitivity, and reduce inflammation. Here's a foundational dietary approach to follow. What to focus on. High fiber foods. Fiber slows down sugar absorption. Load up on leafy greens, broccoli, berries, beans, and lentils. Lean protein. Protein promotes satiety and helps stabilize blood sugar. Include chicken, fish, tofu, eggs, beans, and lentils with your meals. Healthy fats. Healthy fats are crucial for hormone production. Incorporate avocados, nuts, especially walnuts and almonds, seeds like flax and chia, and olive oil. Anti-inflammatory foods. Think of a rainbow on your plate. Colorful berries, fatty fish like salmon, rich in omega-3s, turmeric, and ginger are excellent choices. What to limit or avoid. Sugar and refined carbohydrates. These are the biggest disruptors for PCOS. They spike your blood sugar and insulin, worsening symptoms. Minimize sugary drinks, candy, white bread, pastries, and other highly processed carbs. Highly processed and inflammatory fats. Reduce intake of fried foods, processed meats, and foods high in trans and saturated fats, which can drive inflammation. More lifestyle solutions and important precautions. Nutrition is a cornerstone, but it works best when combined with other supportive lifestyle habits. Lifestyle solutions. Consistent movement. You don't need intense, stressful workouts. In fact, gentle, consistent movement is often more beneficial. Brisk walking, yoga, cycling, or swimming for 30 minutes most days can dramatically improve insulin sensitivity and help regulate your cycle. Stress management. High stress elevates cortisol, a hormone that can disrupt your entire hormonal balance. Practice daily meditation, deep breathing exercises, or simply spend time in nature. Prioritize getting 7 to 9 hours of quality sleep, as poor sleep is a major stressor on the body. Supportive supplements and herbs. Important precautions note here. Some studies suggest that spearmint tea may help reduce excess androgen levels, and cinnamon may improve insulin sensitivity. Inositol is one of the most well-researched supplements for PCOS for improving metabolic and ovarian function. However, Crucial precautions. Always consult a healthcare professional before starting any new diet, herb, or supplement. This is especially critical with PCOS and when considering pregnancy. This video is for educational purposes and is not a substitute for personalized professional medical advice. Be patient and kind to yourself. It took time for your body to become imbalanced, and it will take time to heal. Progress is not always linear. Celebrate small, non-scale victories like having more energy or a more regular cycle. Preparing for a healthy pregnancy with PCOS. If you have PCOS and want to get pregnant, all the steps we've just discussed are your essential foundation. Regulating your cycle and improving your metabolic health is the most important first step. Additionally, start a prenatal vitamin early. It is recommended to start a prenatal vitamin with at least 400 to 800 micrograms of folic acid at least 1 to 3 months before you plan to conceive to prevent neural tube defects. Improving your metabolic health. As mentioned, achieving a healthy weight, even a 5 to 10% reduction from your current weight if you are overweight, can be powerful enough to restore spontaneous ovulation and significantly increase your chances of a healthy pregnancy. Track your cycle and seek support. Use an app or calendar to track your periods. This data is invaluable for you and your doctor. When you're ready, have an open conversation with your OB/GYN or a reproductive endocrinologist to create a plan. Remember, having PCOS does not mean you can't have a healthy pregnancy. It means that preparing your body proactively is one of the most loving things you can do for yourself and your future baby. Your body has a remarkable capacity for balance and healing. By listening to its signals, nourishing it with the right foods, moving gently, and managing stress, you can support your hormonal health, manage your PCOS symptoms, and build a strong foundation for your future. You are capable, you are informed, and you are strong. If this video gave you hope and practical knowledge, please give it a like to help other women find this important information. For more evidence-based wellness guides, subscribe to our channel and click the notification bell so you never miss a video. In the comments below, we'd love to know what is one small change you feel inspired to make for your health this week. Let's support each other on this journey.